idea that people that are watching these videos are people that are currently enrolled in a pathophys class, are people that are far into their courses or careers and are reviewing for board exams and whatnot. And anywhere you take a disease or a pathology or pathophys class, at the bare minimum you have to have human anatomy and physiology first, because this is a course that revolves around disease and basically what goes wrong with bodily organs. So you obviously have to have a functional understanding of everything when they're operating normally, and it's kind of hard to understand what happens when operations go awry if you don't have that foundational knowledge. So I just kind of want to throw that disclaimer, that warning out there for people. I'm not saying don't watch these, I'm just saying that your understanding of these topics and concepts will be a lot more solid with an anatomy and physiology background. So on that note, let's get into this. So basically, this is just going to be the first of many lectures on pathophys, and in this video, we're going to cover a lot of introductory topics, or we could say foundational topics, that are going to be important, and you'll see a lot as you go through not just the course of this class, but just as a course of your college education and into your career. And a lot of these terms are probably going to be familiar to you anyway, because you hear a lot of these terms and concepts used on the news, on the news, or if you read them in a newspaper article, a journal article, a magazine, or whatnot. So there's going to be a lot of foundational topics here to focus on. All right, and one of the things, though, that we do need to focus on is understanding the difference between pathology and pathophysiology. And then we'll talk about clinical manifestations and some terms that are associated with signs and symptoms, and then terms associated with diagnosis and treatment, and then we'll kind of talk about disease on a larger scale and talk about populations. So basically, in a nutshell, in this video, you're gonna have a lot of introductory terms thrown at you that are related to the entire duration of this course. So first off, let's talk about the difference between pathology and pathophysiology. So I mean, basically, whether you're taking a pathology class or you're taking a pathophysiology class, these classes revolve around disease. All right, these classes revolve around disease, plain and simple. And I'm going to apologize ahead of time for my handwriting. I'm using some newer gadgets and technology here, so bear with me. And basically, diseases occur when homeostasis goes awry. And remember, homeostasis is a state of balance when functions in the body are operating. We can, under normal conditions, we can compensate for environmental stresses and pressures. All right, our blood pressure rises and falls on a daily basis depending on our activity, but we can, on our own, keep it, within the normal functional parameters that keep us healthy. But if we are unable to do that on our own, then, well, there's going to be problems. All right, so basically, disease is homeostasis gone awry. All right, and basically, pathos means feeling or suffering, and basically, whenever you see this word root, patho, you should just automatically think disease, plain and simple. All right, disease, disease, disease. All right, and then ology, a little terminology review, is the study of, all right, now this is where it gets to be a little different. So, I mean, you see pathology, ology. So obviously we're studying diseases, but from different perspectives, all right? Because basically physis means nature or origin, it's again, a Greek term. And obviously you see this in physiology, all right? And physiology, is basically function, all right? Or the mechanics of the body. All right, so the mechanics of the body. So basically, pathophysiology is understanding the mechanics of disease and understanding this really from a cellular level. So what happens at the cellular level in organs that cause them to function abnormally, whether it's an infection, whether it's just mitosis gone wrong, a cancer, genetic disorders, and so on. All right, so basically pathophysiology is like anything else in physiology. You're looking at the step by step by step by step mechanics of a disease. Whereas pathology is more related to anatomy. Pathology is identifying diseases, predominantly through, dissections, microscopes, and so on. Because, when you hear about a pathologist and what a pathologist does, you hear about them doing dissections and whatnot, but they do far more than just do autopsies. I mean, they have to sample tissues, stain them, look at them under microscopes to identify the cellular changes. All right, so when you see pathology, think anatomic changes in the body that cause disease, and pathophysiology would be the cellular mechanics that allow a disease to progress. All right. And again, you have to bear in mind, though, that that all this revolves around homeostasis and a state of balance. All right, and if we lose our state of balance, then that is going to require medical intervention. All right, because that's what this is all about. And typically, this ability for us to physiologically stay balanced gets a lot worse as we age. All right, just as our body deteriorates and just undergoes the normal processes of aging, which will be one of the last topics we talk about. More medical intervention will be necessary. All right. So etiology, let's talk about this term first. This is a term you're going to see a lot, all right? And this is a very straightforward term. Etiology, you're just saying, all right, the cause of a disease. All right, what is the etiology of this disease? All right, and there are various causes of diseases out there. All right, and one of the most common agents or causes of a disease would be a pathogen. All right, so this would be a good opportunity for you to just maybe pause for a second and take your pen and your notebook while you're sitting here watching this and try to write down examples of what you think various pathogens would be. So do that for a second. All right, so examples of pathogens could be bacteria. All right, could be a virus. All right, fungi, which isn't very common, more common in immunocompromised patients, but bacteria, viruses, fungi, those are all examples of pathogens. Basically, another way to look at a pathogen as well would be environmental agents that can cause diseases, because, for example, there are, there's more than just environmental pathogens that can cause diseases. There are, genetics is also a factor here. All right, so genetics. So, bad genes could be, for example, there are certain cancers that are within family, that are within families, hypertension, and so on. All right, so you have to keep that in mind, that that it's more than just the environment that's causing problems. It could be us as well. All right, and some terms that are related to etiology, one of them being multifactorial. All right, multifactorial. Basically, multiple, many, and factorial factors. So basically, when you see this term, what we're saying here is there are many factors that are contributing to a disease. All right, and that just kind of goes right back to what I was just talking about, is that many diseases are a combination genetics and environment. All right, for example, like if you think about like high blood pressure, high blood pressure is very common in families. All right, but that doesn't mean, just because high blood pressure is in your family, it doesn't mean you're going to get full-blown hypertension. And hypertension is the clinical term for high blood pressure, and it's just going to run out of control. You have to manage your lifestyle as well. Especially if you know that it's in your family history. All right, if cardiovascular disease in general is in your family history, exercise, eat right, all right, manage your stress, all right, there's more, again, there's always multiple factors that go into a disease. So just because you know that a particular disease is in your family history doesn't necessarily guarantee you're going to see the most severe effects of it, all right, and that's not always the case. Like for example with Huntington's chorea, for example, you have a 50-50 chance of inheriting that disease. There's not much you can do about that, all right. But there are also many diseases like high blood pressure, type 2 diabetes, and so on that are very manageable. All right. So multifactorial, many factors that contribute to a disease. Nosocomial. All right. Basically, when you get sick in a healthcare environment, all right, or what are often referred to as hospital-acquired infections, or HAIs. All right. HAI. All right. So now you're probably sitting here thinking to yourself, well, how do people get sick in a hospital? Because hospitals are supposed to be sterile. Hospitals and clinics alike are supposed to be very sterile, clean environments. All right. Well, they're not perfect environments. You have to keep that in mind. All right. And there are factors that can lead into this. Probably one of the more common examples of a nosocomial infection is Mrsa. All right, Mrsa, M-R-S-A. all right, which stands for methicillin-resistant Staphylococcus aureus. It's a bacterial infection that occurs in hospital settings. All right, typically it's very common in patients who have weakened immune systems, are often undergoing dialysis and kidney treatments. All right, it's called methicillin-resistant because this type of Staph aureus is resistant to that particular antibiotic. All right, so that's something you have to keep in mind. That's kind of how they, and bacteria become resistant to antibiotics from exposure to antibiotics. All right, so, that's not the most, again, that's not the only example of hospital-acquired infections. I mean, probably in the United States, the most common would be UTIs. All right, would be a urinary tract infection. And more often than not, UTIs come from they're not always the practitioner's fault, but oftentimes they can be if you don't follow the procedure of cathetering a patient correctly. If you contaminate the catheter and still continue to put it in the patient. All right, oftentimes with indwelling catheters, if they're left in for too long, it's almost guaranteed if they're left in too long, a patient's going to acquire an infection. I said almost guaranteed. I don't want to make it sound like it's 100%. All right. Oftentimes with surgery as well, patients' surgical wounds get infected. All right, and which sometimes is going to happen. I mean, just because we have a lot of microbes on our skin, and if we don't properly clean and treat the wound, then it's going to happen. All right, if we don't take the right precautions. But so oftentimes, the nosocomial infections can be caused just the environment you're in, by not maintaining a sterile environment, all right, or sterile procedures, just flat out negligence, all right, and that's something you have to keep in mind because when these happen, especially if it's done through negligence, that's going to cost a lot of money, not just the patient, but the hospital, because you have to remember, you as a healthcare professional, you are a representative of the clinic or hospital that you work in, all right, and when you make a mistake and a patient has to suffer the consequences of it, the whole clinic suffers or hospital, the healthcare facility suffers the consequences as well, through lawsuits, processing, and so on. All right, those get to be expensive. So the moral of the story here, people, is pay attention to what you're doing. All right, as a student, going through this, you need to make sure that when you're teachers, whether you're going to nursing school, whether you're going to school to be a doctor, medical assistant, surg tech, whatever it may be, you need to make sure that you follow directions and you master these skills that you're being taught, because you're being taught these for a reason, to take care of the patient. All right. So those are nosocomial infections. Iatrogenic infections, basically or diseases, are caused by treatments. All right, and various causes of these. Probably the most common cause, especially what you hear about here in the United States a lot, is you guys watch TV, and this just drives me bananas when you see all of these pharmaceutical commercials on TV. All these medications are being marketed out there. And doesn't it just drive you nuts that half the time the side effects are either worse or the same as, or there's more than what the person actually has? So if you have an adverse reaction to a medication, all right, that is an iatrogenic cause of a disease. I still never. It blows my mind when I see commercials on TV for antidepressants, and they say, side effects of this could be nightmares and suicidal tendencies. Well, call me crazy, but don't those and depression probably not mix very well together? Or if they cause, leaky things to leak out of orifices of your body. I don't know. Call me crazy. I'm just not a fan of that. So, but again, these are your treatments. Like for example, we know there's a lot of adverse effects with chemotherapy when we're treating cancer. I've known patients who have come out of chemotherapy. Granted, their lives were saved as a result of it, but who have come out, as diabetics and so on, hypertension and whatnot. All right, but oftentimes, but the thing is, though, is these treatments aren't going to be administered without the patient knowing of all of the potential effect, because that is illegal to do that. So that's something you have to understand as a future healthcare professional, is that it's your job to make sure the patients are educated as to the, about the treatments that they are undergoing, because there are certain risks with these. All right. All right. And another thing that I want to mention that can go along with both nosocomial and iatrogenic are documentation errors. All right, documentation errors. Make sure you're documenting properly as well. All right, because if you write down the wrong dosage, wrong medication, you mix up patients' charts. All right, that could get people killed or severely hurt. All right, so that's something you have to keep in mind. And I know this is going to sound hypocritical, me saying this right now, but write legibly. All right. Idiopathic. Idio basically is Greek for idiot, and so basically from a professional standpoint, we are calling ourselves idiots because we don't know the cause of the disease. So basically, whenever there's a disease out there that we don't know the cause of, that's idiopathic. All right. We know with a lot of diseases there are certain factors that can contribute to the persistence or the development of a disease, but the flat-out cause, like for example, just even high blood pressure, primary hypertension, we don't really know what causes that. All right, obviously we know a lot about the effects of it and how to treat it, but we don't really know the cause of primary hypertension, something as simple as that. All right, and there are many other diseases out there as well, but we know how to manage them. All right, so whenever you see idiopathic, basically just think no known cause. All right, so remember, etiology is basically the study of is the causes of disease. All right, and there are various factors that can contribute to disease, ranging from our own biology and genetics to environmental factors and various pathogens out there in the environment. All right, so let's talk about signs and symptoms. All right, now it's important to understand the difference between these two. All right, so basically a sign is an objective, measurable manifestation. All right, an objective, measurable manifestation. And a symptom is unobjective. It's often a feeling that the patient is experiencing. So again, this would be a good time to maybe pause for a second and think of some examples of each. Kind of categorize these examples and see, see what you can come up with. Now, if you go down here, I put two images down here. All right, this is a person running a fever, and this is a patient who's getting an injection and doesn't look like they're having the best of times. So let's think about this for a second. So over here with this patient, would this be an example of a sign or a symptom? This would be a sign. All right, you can see the thermometer here. The thermometer, basically, we can measure the temperature. When a person has an infection and they're running a fever, we can measure that temperature. Okay, so fevers are a sign. All right, if a little kid falls out of a tree and they land on their arm and they break it and a bone is protruding from their body, I think it's a pretty obvious sign that maybe they broke a bone. Okay, if a person has severe edema, all right, and you can see the water welling up in their tissues, all right, that is a sign that there is edema, all right? So you get the picture here. Basically, what you as a healthcare practitioner can see and measure yourself, that is a sign, okay? Whereas a symptom is an unobjective feeling, all right? Now, I don't want to sound too, I'm not saying unobjective to be crass or to take away from what the patient is experiencing. It's just that, for example, this is obviously pain right here. Okay, that's pain. All right, now how people experience pain, that varies a lot from person to person. Culture has a lot to do with how people perceive and show pain. Gender has a lot to do with it, all right, because females are known to have a higher tolerance for pain. Age, personality, there's a lot that goes into pain. Granted, if you're a guy and you value your life and you have a beautiful gal who's pregnant and giving labor or experiencing labor pains, use your head and not tell her that, oh honey, the pain is only subjective, it's in your head. If you value your life, don't do that. All right, but you get the picture here. One person could experience stomach cramps very differently from another person. So so that's why when it comes to pain, you have to ask very specific questions to try to pinpoint, is it on a scale from 1 to 10, 1 being barely any, 10 being worst pain you ever felt in your life. Is it burning, numb, tingling, so on? Is it persistent? Has it been getting worse? Is it, so on. There are these certain questions you're going to get taught to ask patients just to try to identify pain. Nausea would be another example. All right. Now, because nausea doesn't always mean a patient's going to projectile vomit. All right. But vomiting would obviously be a sign that something is wrong. Stomach infection, fever, GI disorder, whatnot. All right. But you got to remember, just because a person is nauseated because they feel sick or queasy to their stomach, it doesn't mean that they are going to vomit. All right. But obviously, something is probably wrong. All right, so signs versus symptoms, and a clinical as I said before, these are examples of clinical manifestations, and you have to remember, basically, when we're talking about clinical manifestations, we're basically talking about how is this disease presenting itself? All right, what can we as a practitioner measure, and what do we have to rely on from the patient to give us information about that? All right, so it's important to understand the difference between local and systemic. Local means within a specific area, whereas systemic means basically think system-wide, body-wide. All right. So again, if someone, go back to the example of a kid. If that kid fell out of the tree, broke their bone, and the bone is protruding out of the arm, it's safe to say that's local. Okay, it's safe to say that's local. All right. If someone has sepsis, that's going to be systemic. Basically blood poisoning. Bacteria getting into the blood. There are certain, severe allergic reactions, like anaphylactic reactions, all right, are going to be fairly systemic because you're affecting essentially more than just one area. Many areas of the body at once are being affected by that. All right, so local is isolated to one area. Systemic is more widespread. All right, acute versus chronic. Acute basically means rapid onset. Okay, you're seeing the signs and symptoms of this really fast right away. Whereas chronic, what we're saying here is over a long period of time, persistent. All right, this disease it may be taking a while to manifest, but it's not going away. All right. All right, like for example, diabetes, like type 1 diabetes is an example of a chronic disease. All right, it takes a little while for the just because of how it manifests. Because you typically, like with type 1 diabetes, it doesn't hit until, kind of the, 5 to 7 to 8 years old, even into the teens. All right, but that's a disease that sticks with you for life. Granted, we're coming up with treatments and remedies for that, like pancreatic islet transplants and so on. But if you don't get one of those, and it doesn't, or you do, and it doesn't really take that well, they are actually fairly successful right now. But that's for another topic for another day. But you get the picture here. Chronic disease is a persistent disease. Hypertension is another example of a chronic disease. All right, an example of an acute would be, you have a fever, you get the seasonal flu. All right, it's gonna hit you pretty quick. It's gonna last for a few days or a week, and then it's gonna go away. All right, so acute versus chronic. Acute, rapid onset. Chronic, persistent over long periods of time. All right, insidious basically means gradual onset. Okay. Basically, gradual onset, and not just gradual onset, but cumulative effects. Or think cumulative. A good example of this would be stress. Now, stress isn't always a bad thing. There is such a thing as good stress, which we'll talk about later on. But in general, when you hear about the word stress, when you hear the word stress, you think bad things. Like a job is stressing me out, a relationship is stressing me out, financial woes are stressing me out, all of the above. All right, whatever it may be. All right, stress can come in negative effect, or it can come very negatively. And if you don't manage that stress well, the effects of that will just pile on over time, because the effects of stress don't hit you right away. Like, for example, when you think of someone developing an ulcer, all right, those don't develop within a day. It takes chronic stress. It takes persistent stress for that ulcer to gradually develop, all right, due to lack of blood flow to certain organs, all right, immunocompromise and so on. Okay, so that's insidious. Exacerbation. I bet this is a term a lot of you have heard before. Basically, when you see the word exacerbation, that just basically means you're making something worse. All right, you're irritating, you're increasing this, you're enhancing the signs, you're enhancing the symptoms. All right. the signs or the symptoms. All right. Like you hear this a lot with people who have asthma. Like someone will say, I was around a cat and it exacerbated my asthma or so on. All right. So that's all that word means. You're just taking something that's already there and making it worse. Okay. Subacute. Basically, this is a clinical manifestation or a problem that kind of falls right in between acute and chronic. Like for example, like endocarditis, for like subacute endocarditis, basically which is essentially a heart infection. All right, it's an infection that kind of it slowly takes a little bit of time for the effects to accumulate, but then they get worse over time, and if left untreated, that will, it could take up to a year for it to see, severe fatal effects, but it's something that you can manage even without treatment for a while. But obviously, if you have a heart infection, get it taken care of. All right, so subacute is just kind of in between these two. Well, kind of it is. All right, now remission. I think this is an important word to talk about because this is a word you hear a lot. Now, it's important that you understand this definition here. Symptom-free period. Symptom-free. That doesn't mean the disease or the problem has gone away. It just means that you are not showing any signs not showing any symptoms of the disease. For example, the most common example you hear remission being used is with cancer. All right. Now, just because someone has gone into remission with cancer doesn't mean the tumor has gone away. Oftentimes, it just means the tumor has maybe shrunk a little bit, or it's not growing. All right, and it's not causing any more negative effects. So you have to keep that in mind. Remission isn't always a golden ticket, but it is news you do want to hear. All right. So keep that in mind. Symptom-free periods. And asymptomatic. Basically, whenever you see the letter A in front of something, that means without. Okay, so if someone is asymptomatic, no noticeable symptoms. All right, for example, hypertension, high blood pressure. There are no signs or symptoms of that. People typically don't know they have high blood pressure until it's persisted so long to the point to where it's starting to cause, vascular damage and so on. Most of the time, people figure out they have high blood pressure when they, go in for their regular checkup and they get their blood pressure measured and it's abnormally high, and then you have it measured a few more times because you can't just go off of one reading. And it stays, and it is persistently high, then you would say that, this person would be diagnosed with hypertension and they have to figure out how to treat it. All right. So asymptomatic basically means no noticeable signs or symptoms. In terms related to diagnosis and treatment, basically what we have, a diagnosis is basically labeling a disease. All right, you're identifying an identifiable label. Every time you hear someone give the name of a disease, that's a diagnosis. And obviously, in order for a healthcare professional to make a diagnosis, all right, some are obvious. Again, kid falls out of tree, bone protruding out of arm. I don't think you need to be a highly trained professional to figure out the kid broke his or her arm. All right, but there are many diseases out there that require lots of testing. All right, taking samples from patients. All right, running them through labs. Patient questionnaires, gathering a patient history, and it's important. That's a really key part of that is getting a patient history, making sure the patients are honest. All right, because it is. Oftentimes patients do lie. All right, it's not just some thing they made up for the TV show House MD. That is pretty true. Lying is a defense mechanism. All right, and especially when it comes to medicine, because initially we don't want to admit that there's a problem. All right, it's just it's our unconscious psychology kicking in and saying, I don't know, who would want to actually face the fact that they have cancer, or admit that they just have some kind of a problem in the first place, or that they have a behavior that is leading up to that. All right, so it's important that you gather the appropriate information from a patient so a proper diagnosis can be made. All right, so hold your patients accountable, basically, is what I'm saying. Now, prognosis is basically forecasting outcomes. I'm sure that's a word you've heard a lot about. Now, you have to bear in mind that a prognosis is you're not guaranteeing anything with a prognosis. All right, you're just saying that, look, there's a certain chance that if we undergo this treatment, the survival rate is X plus Y equals Z, essentially. All right, so you have to keep that in mind. A prognosis isn't a guarantee. You're just basically laying out the outcomes and figuring out what path will work the best, which treatment path will work the best. Some patients may decide to go the homeopathic route, some will go surgery, some may try pharmaceutical. It depends on the situation, because the prognosis is going to vary from patient to patient. All right, so that's something you have to keep in mind. Is a prognosis, you're forecasting outcomes, you're not giving guarantees. All right, and then morbidity versus mortality. All right, now these are often terms that are used that are associated with populations. Morbidity is basically a disease rate within a population, whereas mortality is a death rate within a population. Obviously, oftentimes there's a strong correlation between the two. All right, morbidity and mortality. All right, if there's a higher prevalence of a particular disease in a population, there's a chance, depending on the disease, that it could cause a higher death rate within that population. All right, and obviously there's a lot of specifics that goes into this. You have to look at everything from, what is the average age range of this population, race and ethnicity of the population, what are their living conditions and standards like. There's a lot that goes into morbidity and mortality. All right, and the CDC puts out a weekly morbidity and mortality report on a weekly basis. And if you go to this website here, you can actually see. It's all free information because it's public information through the government. You can look up morbidity, mortality rates of very specific diseases within your states. Within the whole country. There's a lot of information out there related to this. All right. So morbidity is disease rate. Mortality is death rate. So, let's give an example of this before I go on, instead of just flapping about the terms. Let's talk about let's talk about obesity. Okay, obesity, and I'm just going to abbreviate this: cardiovascular disease. CV, cardiovascular, not resumes. All right. So, if we find that, so oftentimes in populations where there is an increased rate of obesity or just even overweight, out of shape people, there oftentimes is a higher prevalence of cardiovascular disease. And then, obviously, what do you think the death rate is going to be like that's related to this? All right, so that's something you have to keep in mind. And obesity, I think obesity is a little bit of a loosely used term, because people who are obese have lots of body fat, lots and lots of body fat. They're way over their weight and body composition for their age range and so on. But again, whether you're overweight or obese, those are contributing factors to cardiovascular disease. And if there's a higher prevalence of cardiovascular disease in that population, well, guess what? There's probably going to be a higher rate of as well, a higher death rate. All right, and that's basically what the CDC and other organizations do. That's what they're trying to control when we're trying to basically get people to be healthier. All right, get them in shape so we can lower the risk of this. And basically, if we cut these down, we lower death rates in the population. All right, so you see the connection there. Hopefully I explained that well enough. And then the last thing I want to talk about is population health. All right, epidemiology. All right, epidemiology is a study of diseases within populations. Don't confuse that with etiology. Remember, etiology is the study of causes of diseases. Epidemiology is studying populations, or studying diseases within populations. All right, and that essentially is what that morbidity and mortality report that the CDC puts out on a weekly basis is doing. They're studying and assessing various diseases that are within populations, how they affect those populations, and obviously that information gives you prevention and treatment outcomes. All right, so incidence and prevalence. Let's talk about the differences between these two. Incidence is the rate of occurrence, whereas prevalence is the percent of the population that's affected by this. So, for example, in 2006, there were 56,000 people diagnosed with AIDS in the United States. All right, and during that time, the population was about 300. million. All right. So basically, so what we're saying here, out of these 300 million people in the United States, the incidence of AIDS would be 56,000 people, and the prevalence of AIDS would be right around 19%, about 18.5%, 19%. Okay, so almost 20% of, but either way, whether it's 18.5%, 19%, almost 20% of that population, of the population in the United States, was diagnosed or identified to have AIDS. Okay, so that's basically what incidence and prevalence is. And I chose this one because using cardiovascular disease and obesity would have just been way too depressing for the United States. Not that this is uplifting by any means, but you get the picture. All right, and then some other terms, important terms I want to talk about are endemic, epidemic, and pandemic. All right, endemic, epidemic, and pandemic. Endemic, this is a very common word. I mean, this is a word you see like used in anthropology, sociology kind of studies as well. When you hear about a group of people that are endemic to an area, a population that's isolated to a specific area or lives within a specific area. All right, and the same goes for a disease as well. Basically, a disease affects kind of a regular to a smaller area, and then epidemic means a disease is spreading to basically more widespread. It's spreading basically throughout the country, getting larger and larger. And then pandemic, we're basically talking about crossing borders. We're talking about worldwide, crossing continents. All right. So again, let's use the example of HIV and AIDS. All right. Endemic. All right. If we look at the history of HIV, basically, it's pretty much been, by most, virology professionals out there, it's been found that it's been, known that it's originated in West Africa. All right, within the Congo jungle, if I remember correctly, or the areas of the Congo in West Africa. Now, basically that occurred because of, individuals that were endemic to that area, were eating monkeys, which obviously you have to eat. All right, and there was a different version of this called SIV, called Simian Immunodeficiency virus. All right, and then basically what happened was, whoever was hunting and whoever hunted and killed the monkey had to butcher the monkey, and then there was, basically this virus, and then that hunter had a cut on their hand, and that there was basically blood to blood mixing, contamination. All right, and then this version of the virus is relatively harmless, but once it got into humans, it evolved into what we know of as today as the HIV virus. All right, and then it kind of stayed endemic within that area, but then as people, and you know how HIV is spread, primarily through body fluid contact and so on, and obviously in this situation, primarily, more likely than not, through sexual contact. All right, and then as people branched out from here and moved to more populated areas, then this became more of an epidemic. All right. Then as people started emigrating and moving out of the continent and to other areas, then that makes, HIV and AIDS, or I should say AIDS. HIV is the virus. AIDS is a pandemic. It is a worldwide problem. All right. So that's something you have to keep in mind. So that's what these terms mean. And don't let the media throw you off, like with that whole H1N1 snafu a couple of years ago when they threw this word around like it was going out of style. Oh, if we don't do this or that, this worldwide pandemic. The seasonal, flus circulate all the time. It was understandable to keep an eye out and be have caution about that virus because it was a slightly newer version of the strain of that H1N1. But to scare the crap out of the entire world the way they did, I don't know. I just wasn't a fan of how the media and the government handled that, but I'm not a fan of how they handle most things. So, and if there's any viewers on here that want to get into conspiracy theory or listen to Jeremiah Wright and talk about how, oh no, HIV was a man-made creation targeted to kill certain groups of people, save that garbage, please. I don't want to hear it. People that say that are people that have no biology background, when you take a look at the people that are actually spouting that stuff. So, So that's terms related to population health. And then last I want to talk about is disease prevention. And as future healthcare professionals, you have to know and understand that this is one of the most critical parts of your job, is preventing not just patients but yourselves from getting ill and sick. And there are three forms of prevention out there: primary, secondary, and tertiary. Primary is when you take direct action to prevent yourself from getting injured, sick, or harm. You know, like putting on a helmet when you're getting on a skateboard, or wearing safety goggles, just wearing rubber gloves when you're going in to examine a patient, do a physical examination on a patient. All right, all of those are examples of primary prevention. You are taking precautions yourself to to not get sick or not get hurt. Secondary basically is early detection. I mean, obviously the most common thing you hear about would be, the self screenings. Females checking for, palpating your breast to check for lumps. Guys palpating the scrotum to test for lumps, to self-assess for breast and testicular cancer, mammograms, prostate checks. I mean, you get the picture here. Basically, using medicine to detect if there's a problem and to nip it in the butt as quickly as possible. That was a really bad example to use after I talked about prostate exams, but you get the picture. And then tertiary prevention is obviously when a disease has been identified and basically we need to treat and rehabilitate the patient from that. All right, and unfortunately, this is probably the biggest part of medicine today in the United States. Luckily, it is taking a shift more towards here and here, but there's still a lot of work that has to be done. I mean, society, there's a lot of mentality changes that have to occur in society. For example, people have to stop blaming Twinkies for making them fat, versus sitting on your butt eating them and not exercising and wondering why you got fat. All right, I mean, people need to undergo the right behaviors to prevent problems. All right, and if there is a problem, early action. All right, but it's more than just medicine making the shift. Society has to make the shift as well, and this quick fix mentality that is out there needs to go. It needs to stop. This pointing the finger in every direction, except ourselves. That mentality has to stop, and you as future healthcare professionals need to be on the front end of that. All right. But this is basically the first video of pathophysiology and a lot of introductory terms and concepts. And I should just show that I properly cited my sources for all the images that I used in here. Again, if you have any questions, let me know, and just keep an eye out because I'm going to try to put these out on a weekly basis.
Okay, any questions? Questions for Dr. ඕනෑ කියලා කියන්නේ. Questions තියෙනවද නැද්ද? ඔයාලන් break එකක් වුණේද දැන්? Yes, no? ඒකටවත් නැද්ද? No, break. Any questions? Can video again. Okay, so tell me, what is pathphys? What is pathophysiology? Give me the definition of pathphys. If someone asks you what pathophysiology is, what is your definition? What is pathophysiology? What is pathology? ඒ word එක දෙකට කඩන්න. What is pathology? අර මොකුත් නැහැ. Okay, what is physiology? Functions of living organs. So you combine the two words, pathology and physiology, you get pathophysiology. That is the diseases and how it's going to affect the living organs in your body. Okay, so that is basically your topic. Okay, today you will cover the introductory part just like you did in the video. Alright, just the key terms, all the small terms, medical terms that you all need to know to continue the chapters that's going to come after that. Okay, so today basically you all won't have a lot of work, but you all need to know the key terms, what you all are going to use in this topic. Okay, so like you all said, pathophysiology is the study of abnormalities or the diseases that comes and that's going to affect the living organisms, the normal functions, how it's going to affect the normal functions of the living organisms. That is what consists of your entire system. Okay, so when it comes to this, we talk about four main points, right? Four main components. First is etiology. Okay, these are the four things. If you all are given example, example cancer, and you all are told to write the pathophysiology, right? You all are told to explain the pathophysiology of cancer. Then these are the 4 points, right? Cancer or diabetic or whatever it is, the long-term illnesses. These are the 4 points that you all are going to describe. Okay. First is etiology. What does that mean? What is etiology? The cause. Okay, whatever disease it is, the cause or the reason why it is caused, right? Example, it can be a bacteria, it can be a fungal, it can be a trauma, whatever reason, what the reason is. Second is pathogenesis. What is pathogenesis? Right? Pathogenesis is the transformation from the normal to the abnormal state. Also remember, in this etiology part, it can be one reason or it can be more reasons. Right? It will not always be just one answer or one reason. Right? It can be multiple reasons. Something like heart diseases. Right? Heart diseases, well, there is not just one reason. It can be the diet you take, it can be lack of exercises, the routine you have been doing, right? Maybe genetical, maybe your parents had generation wise. So there can be a lot of etiological reasons when it comes to diseases. Okay, pathogenesis is the process which changes normal body into abnormal one. Right? Look, I have put it in simple English. Just ask before we move to the next slide. Okay, otherwise it's going to be difficult. Okay, and then clinical manifestations. Tell me the definition of signs and symptoms. How are you going to differentiate what is a sign, what is a symptom? You also saw it in the video. Okay? Tell me, yeah. What do you mean by signs and symptoms? Signs are what? Signs are something that you can measure or something that you can see. Right, if you are a nurse, right, if a patient comes to you, right, signs are what you can see in a patient. Maybe the patient might be feeling weak, right, or they might, I don't know, look very pale. Okay, depending on the situation what it is, depending on the disease what it is, right, signs are something that you can measure or that you can see as another person. What about symptoms? Symptoms are what you feel, right, as a patient. Symptoms are not something that others can see. Symptoms is only to the person who is suffering with a certain disease. Give me a few examples. Pale. Pain. Yeah. What else? Nausea. What are the other symptoms? You put yourself, if you have high fever, right? If you have high fever, you can't walk, you have a cold. Sorry? Sweating, you can take it as a sign also, because if you are excessively sweating, then another person can see. Right? You might not feel it sometimes, depending on the situation, but another person can see. Right? Just think, if you are having high fever with cold, cough, whatever it is, what are the things that you will feel? Okay, pain is there. Headache. Okay. Dizziness. What else? Burning sensation, okay. Huh? Sorry? Tingling sensation, okay. I can't hear. Stress. However, what is the definition of stress? No, it's not wrong. I'm not saying it's wrong, okay? It's not wrong. It's a good answer. Tell me the definition of stress. What do you explain as stress? If someone asks you what is stress, and you all are in the medical profession, someone comes and asks you, what do you mean by stress? What's the answer that you're going to give? Unexplainable what? Unexplainable fear. Okay, fear is a part of it. It depends on what situation you're under stress for, right? Whether it's maybe financial kind of stress, yes, that will bring a lot of fear to you. How you're going to survive for the next few months. But what is the actual definition of stress? How are you going to differentiate, or rather define it? What is stress? Okay, unexplainable is yes. Stress you can't explain in just one word or one sentence. Unexplainable what?
Some kind of mental disturbance.
Okay, mental disturbances. Fear includes in it, okay? It's not wrong. I'm just trying to get one complete answer from you.
Tension.
How do you define tension? Pressure above?
Something which affects the mind.
Okay. Stress, tension is a thing, okay, or things that will take you from the normal behavior. Right? If you're under stress, you can't eat properly. You can't do your work properly. Right? If you're having a family, then you can't be around your family properly. Right? Stress and tension are things that will take you from your normal behavior to another level, another standard. Right? So when you say, when you talk about symptoms, right? Stress doesn't come precisely under a certain disease. Right? It's not wrong. Maybe you will. Maybe you're sick because you're under stress. That's a different story, right? But when you ask about symptoms, don't specifically say stress, because you can be sick because of stress, right? But right now what we are talking are symptoms that you will get because of the disease, not what caused the disease. Okay? When it comes to clinical manifestations, you'll have the book name or the tab, whatever it is. Okay? Turn to page 4. Page number 4, there is a table. Right? Table describing different stages and clinical course of disease. Right? When you're talking about the clinical signs and symptoms or the clinical manifestation of a certain disease, right? These are the terms that you need to be sure of. These are the terms that you are going to use. Right? First is, right, you have found near the page. Right? First is incubation period. What do you mean by incubation? In simple terms, incubation period. So when you say period, you know it's a time. It's a time from point A to point B. Right? You know it's a time from point A to point B. So when you say incubation period, when we talk about diseases, what do you say? It's a common word that we use in hospitals a lot. Incubation period is this much. This disease incubation period is this much.
Time period between invasion of microorganisms to the body manifestation
To the signs and symptoms. Okay, incubation period is, example, if you take a mosquito, right? The time from the mosquito bites you until your first symptom or the sign appears. Right? If the mosquito bit you in the morning at 8 o'clock, and if your symptom or the sign is going to be at 6 o'clock in the evening, okay, so your incubation time is from 8 o'clock to morning till 6 o'clock in the evening. Okay, so that is what we call incubation. I just gave you an example, but every disease, when we are going to talk about it, will have an incubation period. Okay, not every disease is going to just get into your system and then start immediately reacting. Okay, some diseases there is a period of 1 to 2 weeks, right? Depends on the disease. Second is prodromal period. What do you mean by that? Prodromal period is the appearance of the first signs and symptoms indicating the onset of disease. So when you get your first sign or symptom, right, and you do the needed or the appropriate test, you know, right, this is the pathway it's going to head. Right? Example, the biggest outbreak right now is the dengue fever. Right? So you know that if you are having the given signs and symptoms, right, and if it's going to be according to the disease that they tell it is, right, you know what test you need to do and to get into a hospital or get the appropriate treatment. Okay? And then subclinical stage. What is subclinical stage? Subclinical stage is where you have certain signs and symptoms, right, but the person or the patient will function normally. Right? You might be feeling weak on and off, you might be feeling nauseated on and off, but still you will be working on fine. Right? So when you work fine, that means it is difficult for us to understand whether you are fine or not. You understand what I mean, right? Right? You don't know whether you're supposed to be treated for a disease or you don't know whether you're just going to let go of that patient because he or she is working out fine. Okay, so that is what is known as subclinical stage. Third, acute condition. Tell me the definition of acute and chronic. What is acute? What is chronic? Sudden onset of signs or symptoms. Okay, sudden onset or of the progression of the disease suddenly. Right, that is what is called acute. What is chronic? What do you mean by chronic? That occurs chronic is if whatever is going to appear is going to take longer time. Right? Example, if you talk about cancer, if you talk about leukemia, right? You have something called acute leukemia, acute, according to the cell it goes, right? You have acute leukemia, you have chronic. So acute is where the onset or the signs and symptoms is happening immediately. Right? Chronic is, it takes maybe months, days, weeks, years, even years it can take. Which is more aggressive, acute or chronic? Acute is more aggressive, acute is more dangerous. Okay? Then, next one, exacerbations. What is exacerbations? You all need to know these words, that's why I am going through it. Right? Exacerbation is sudden increase. Right? We have so many patients in a hospital. You have patients, you say, Uday hondar hitiya kapatta amaruna, right? Kind of that. Okay? Exacerbation is where the patient is normal or fine, right? But suddenly there is a massive increase of the severity of the signs and symptoms that they produce. Okay? Or they show. Next one is remission. Remission is the opposite of exacerbations. Right? Where the signs and symptoms disappear, right? It goes low and it completely goes off, right? Convalescence. Stage of recovery after maybe a disease, a certain procedure or a surgical procedure, it doesn't matter, but whatever it is, the time that you take to recover, right? You also call it in simple terms recovery time. Right, that's a common term that we use, no? Recovery period, recovery time. Okay? And then sequela. What do you mean by sequela? What do you think sequela is? What is sequela? Read the book and tell me. What do you understand by that? It's a pathologic condition produced following the disease phase. What does that mean? What does that mean? Pathologic condition following the disease phase. Right? It is something like a condition that you get after total recovery of a certain disease. But because of that disease only you are going to get the second one. Get what I mean? Understand? Okay, say you have diabetic, which is not 100% cure, but just an example. You have diabetic. You have 100% cured it, treated it. But then after some time you are going to get something that comes out of the treatment of diabetic. Right? A condition that follows the primary condition. Right? Example, you have chicken pox. People who get chicken pox, they are obviously it's cured 100%, but you have that virus in your system. Right? After years and years, even after 50 years, it can come out again. Right? So a disease following a primary disease or another disease that was treated before is what you call a sequela. Clear? Confused?
No.
Confused, yes. Okay, what is a complication? What is a complication? That's a very common word. Complication. When you say complication, how do you explain it? A disease. Okay. A disease is just the one part of the sentence. The full sentence? Huh? No, I didn't hear you. Late stage of some disease. No, not exactly. Late complication is what? It's not the late stage of a certain disease. No. That arises due to what? Another disease, like you said, that arises due to what? Something that changes due to the initial problem. Right? People who have liver diseases and heart diseases can't be treated at the both same time. Right? People who are on long-term medications will also have liver problems and kidney problems. But doesn't mean that if it's a heart patient, you can't stop heart medicine. Right? So those are complications. That's why you have all these random tests being done every 2 months or 3 months or 6 months. Right? Because there can be complications. Right? Long-term medication can cause liver problems, kidney problems, and a lot more. Right? So those are things that you call complications. So when it comes to clinical manifestations, these are the few words that you all need to remember. Treatment implications. What are those? What do you mean by what is the definition of implications? What do you mean by implications? Book definition okay, what do you mean by implications? Tell me the definition of implications. Implication, imply. Implication means you apply something, right? You start something. So when you talk about treatment implications, that is, when you know the etiology, you know the pathogenesis, and when you know the clinical manifestations, you need to know all these three things to start treating a patient. Right? Any disease, you should know how it happened, right? You should know what changes are caused inside your body, and also you need to know what are the signs and symptoms. Right? Once you know these three parts, is the only time that you can start treatment in any disease, in any condition, even for something simple as fever, right? You need to know whether it's a bacterial, viral, right? You need to know what are the changes, right? And then you need to know the signs and symptoms, right? If the patient doesn't have cough, you're not going to give cough syrup, no, right? Simple as that. You need to know the signs and symptoms before you start treatment. Okay, so these are the 4 main components that you need to cover in every single disease, right, when we talk about pathophysiology. So if you ask the framework for pathophysiology, right, if the question is going to be like that, then you have to write these 4 components, right? If the exam paper says write the framework for pathophysiology, then these are the things that you need to write. Okay, clear? Questions? Yes, give a question solved and nothing clear. Okay, so you have your break. It's 10:30. You have your break and come, and then we'll continue the rest. ඔයගලන්ට you all get the presentations නේද? මේ කරන ක්ලාස් එකේ මම විතරක් නේ මම කියන අනිත් presentations ඔයගලන්ට හම්බෙනානේ? අප්ලෝඩ් වෙනවනේ නේ? තියෙනවා හම්බෙනවනේ? Okay, you take your break and come, and then we'll go on with the rest. You can go down now if you want.